professor of cardiology, Ain Shams University, and he is past president of the Egyptian Society of Cardiology, and is one of the very active members, especially in Stent for Life program in Egypt, and he is one of the important members, and he is vice president of the non-communicable diseases branch, which is related to the Ministry of Health as well. We have a 15-minute talk by Professor Sameh Shahin about non-communicable diseases prevalence in Egypt, cardiovascular perspective. So if you don't mind, Professor Mohammed Al-Harbi, we will start with him, then we will start our program later on. Dr. Al-Harbi? Yeah. Yeah, thank you very much. So now with Professor Sameh Shahin.
أهلا بحضراتكم، وبحب أشكر أستاذ دكتور أحمد تاج على الدعوة الكريمة، وبتمنى إن شاء الله مؤتمر ناجح بإذن الله. My talk today is about non-communicable diseases, the global and local burden of these diseases. Let's have a historic background of this issue. عايز اوريكم الجراف ده مهم جدا من الورد بانك، طلع سنة 2009، بيوري قد ايه حصل improvement في ال health condition of among Egyptians along the years. From 1960, the mean life expectancy of Egyptians was almost 46 years, while the improvement of health facilities and the health system, by the year 2007, the life expectancy among Egyptians raised from 46 to almost 70 years, the mean life expectancy among Egyptians. Let me remind you that the major improvement in the mean life expectancy was due to reduction in the mortality rate among the newly born births, and the maternal mortality also was reduced. This is to show you again the improvement in and the reduction in mortality between 1990 and 2015. And the blue line is Egypt, and the green line is the WHO region, to compare that Egypt was even better than the regional countries in improving mortality among newly born and maternal mortality. And this were the driving forces for the improvement in life expectancy. وده اللي خلانا على مر السنين نبص نشوف ان في reduction in the communicable diseases, including maternal, neonatal, and nutritional disorders all over the world. Infectious diseases are becoming less and less as causes of mortality among the whole population worldwide, while on the other hand, the non-communicable diseases are increasing. Whether we are talking about high-income countries or upper-middle-income countries, the incidence of non-communicable disease as a percentage of total mortality is increasing. And even for the lower middle-income countries and the low-income countries, again, these diseases are becoming more and more increasing and becoming more and more responsible for the cause of mortality, even in low-income and lower middle-income countries like Egypt. And this slide is to show you that in most regions of the world, geographical regions of the world, now the cardiovascular disease and the other non-communicable diseases are becoming the most common causes of mortality. Look at the Middle East and North Africa. You can see here that both the cardiovascular and other non-communicable diseases constitute almost 65% of mortality, while only in sub-Saharan Africa are still witnessing the communicable diseases in yellow as the most common cause of mortality. So again, with this slide, I want to remind you that cardiovascular disease is considered the first cause or the most common cause of mortality among other non-communicable diseases that includes chronic respiratory diseases, cancer, diabetes, and mental health and neurological disorders. Cardiovascular disease is the #1 killer among most of proportions of the world right now. And this slide, again, is to show you that ischemic heart disease is the #1 cause of mortality and disability, and that among the past 10 years or so, there is a 30% increase in the incidence of ischemic heart disease, similar to the incidence of stroke. Stroke occupies the position #4, and it showed 20% increase in the incidence among the past 10 years. So both cardiovascular problems, both cardiovascular diseases are common, and they are increasing in percentage among the past 10 years. And this graph from the WHO, it shows that for Egypt, that NCDs or non-communicable diseases are estimated to account for 84% of all deaths, maybe similar to other parts of the world. But mind you that 40% of these deaths are due to cardiovascular disease. So I don't think that cardiologists will be very proud of these numbers, that 40% of mortality among Egyptians is due to cardiovascular diseases. And the problem, again, is that the prediction for the next years is that the probability of premature death from NCDs is increasing for the coming years, and it shows a marked drift from the targets put by the WHO, whether we are talking about males in blue or females in red. So both genders in our country, the trend in NCDs will be increasing in the next years and will be getting more and more far away from the targets put by the WHO. And this is one of the most alarming slides that I'm going to show in this presentation. It shows that the number or the rate of cardiovascular death related to cardiovascular disease among Egyptians is almost 500 mortality every year for every 100,000 population. And this is much higher than other countries in the Middle East, in the region. But the problem, again, if you compare our figures to the industrialized world like the UK, the USA, or Germany, where the mortality there is almost 120 for every 100,000 population. So 100 to 400, I think that we are 4 times greater every year. We lose patients due to cardiovascular diseases, and this is a high incidence and again an unaccepted incidence for our community dealing with cardiovascular patients. This relatively recent study published in the European Heart Journal, it shows Egypt in comparison to other European countries, members of the European Society of Cardiology, and it shows that the incidence of cardiovascular or the prevalence of cardiovascular disease in Egypt is one of the highest among other European countries, and it says that the figure is almost 7,700 among every 100,000 patients. So it's almost 7%. 7% of the Egyptian populations are suffering or at high risk of cardiovascular disease. And this is one of the highest prevalences among the region, among a comparison between Egypt and other European countries. And I just want to give you more information about the cause of this high prevalence of cardiovascular disease. The problem is in the high prevalence of risk factors causing this cardiovascular disease. And two most important abnormally high risk factors in Egypt is the smoking among males. And as you can see, it's projected to increase along the coming next years, and it's drifting away from the target that should be by the WHO. So the first problem is smoking among males, and the second problem is obesity among females in red, as you can see here. Again, it's almost 45% of all adult females are suffering from obesity, and again, it is far away from the target put by the WHO. And this is the incidence of hypertension. Again, we need to see much more reduction in the curve of this hypertension prevalence. And again, this incidence of patients or the proportion of population at high risk for cardiovascular disease or with existing cardiovascular disease in this WHO report is almost 8% of the population. 8% of the population is suffering from cardiovascular disease or at high risk of developing cardiovascular disease. One of the good efforts done by the Egyptian Ministry of Health is this project, which is the Egypt Steps Survey. And this is the latest one published in 2017, when the population of the Egyptians was almost 95 millions. And it was estimated that the NCDs constitute almost 85% of mortality among Egyptians was due to NCDs. And as we mentioned before, that the total life expectancy at birth for Egyptians is almost 71.3 years. And again, this survey showed very important figures among Egyptians just a few years ago in 2017, that almost 7.7% of the Egyptian populations are either having cardiovascular disease or at high risk of developing cardiovascular disease. So it's almost similar to the European figures published in the European Heart Journal. And again, 29% showed prevalence of hypertension, 15.5% raised blood glucose level, 19.2% raised total cholesterol, and the average consumption of salt intake per day was very high, was 9 grams every day. And the current smoking, again, among males was a terrible problem. 43% of adult males are smoking, which is a very high incidence among other countries, compared to other countries. And of course, most of the females were not engaged in vigorous sports or activities. And the majority of our population, whether females or males, were consuming less than 5 servings of fruits or fresh vegetables every day. And again, a very serious problem of obesity among females. almost 49% of adult females were suffering from obesity. Again, this is very much a serious problem, especially among females. وكمان لازم نحيي طبعا واحدة من أنجح المبادرات اللي اتعملت، اللي هي مبادرة 100 مليون صحة، اللي اتعمل فيها مسح على عدد يمكن أكتر من 50 مليون مصري. طلعت برضو بعض الأرقام. بشكر أستاذ دكتورة رندا أبو النجا اللي ادتني الأرقام دي on personal communications، وقالت in this study that the prevalence of raised random blood sugar was almost 5.2% among the total population, a little bit higher in females and a little bit higher in urban governors, for 5.8% of the population were having raised random blood sugar. And this is the prevalence of hypertension. Again, the total was almost 21% having rise in blood pressure, and again a little bit higher in males and a little bit higher in urban governorates. And again, the problem of obesity, overweight in almost 74% of the population, and particularly the obesity is in almost 49.5% among adult females. And again, this is the paper published in the European Heart Journal that compared Egypt to other members of the European Society of Cardiology, and it showed that the prevalence of hypertension among Egyptians was again one of the highest. It's almost 25% of hypertension, while diabetes, Egypt is number one. The highest incidence of diabetes among Egyptians, and here the figure is almost 17.3%. Again, the incidence of obesity, the prevalence of obesity is Egypt occupies the first in a row of among European countries, and you can see here that it's a very high incidence, whether in females, particularly in females, and even in males. The incidence of obesity, Egypt is number one compared to other European and some of the Arab countries as well. So it's a must for the Ministry of Health to take an action. Actually, all the medical community should take an action, and it has been set a couple of years ago that we have a goal to reduce the premature mortality due to NCDs by 15%. And also there were targets that should be reached by reducing the incidence of smoking by 10%, the incidence of hypertension by 15%, and also the physical inactivity and reducing the salt and sodium intake. I think a lot of work has to be done in this area. And again, I'm ending with this report from the WHO that shows that the proportion of population at high risk for cardiovascular disease in this report published in 2018 was almost 8% of the Egyptian population are at high risk or with already existing cardiovascular disease, and that the proportion of high-risk persons receiving any drug therapy and counseling to prevent heart attack and strokes is almost 61%. Again, we should increase this percent. This is unacceptable. And that the proportion of primary health care centers reported as offering cardiovascular disease risk stratification is none. None of the primary health care centers providing this cardiovascular disease risk stratification, and that the reported having cardiovascular disease guidelines that are utilized in at least 50% of health facilities is none. We need to have national guidelines applied by most healthcare facilities in order to be sure that recommendations for preventing cardiovascular disease is on the right track. Thank you very much for your attention.